morning, Miss Como. I'm Jasmine. I'm going to be your nurse today. I'm going to be performing a head and face, eyes, ears, nose, throat, mouth, and lip assessment on you today. Right now, I'm just observing your head shape. It is accommodating to your body structure. I'm going to use my hands and begin palpating your skull. I'm palpating for lumps, bumps, or bruises. Any tenderness as I palpate?
No.
Okay, good. Now I'm going to go ahead and look through your scalp. Your scalp is nice and clean, no dandruff, no lumps, lacerations, bruises, none noted. Okay. Now I'm going to move on and palpate your temporal artery. As I palpate your temporal artery, do you feel any tenderness?
No, I don't.
Okay. I'm going to palpate your sinuses, your maxillary, and your frontal sinuses. As I palpate, if you have any tenderness, please let me know.
No.
Frontal, maxillary.
No.
Good. Okay, now I'm going to assess your cranial nerve number 7, which is your facial nerve. Smile for me. Good. Frown. Puff up your cheeks. Awesome. Okay, now I'm going to assess your cranial nerve number 5, which is your trigeminal nerve. I'll press down on your jawline. Okay, I need you to open your mouth. Close your mouth. Bite down. Good. Okay. Now I am going to assess your neck. As I look at your neck, I'm looking for any lumps, no bumps. I'm going to palpate your trachea. No pulsations, no lumps, no bumps, no bruises. Symmetrical. Okay. All right. I am going to palpate all 10 of your lymph nodes in your neck area. As I palpate these areas, please let me know if you feel any tenderness, Ms. Como. Preauricular?
No.
Postauricular?
No.
Occipital?
No.
Jugulo-digastric?
No.
Submental?
No.
Submandibular?
No.
Superficial cervical?
No.
Deep cervical?
No.
Post-cervical chain?
No.
Lift your shoulders? Supraclavicular?
No.
Okay. All right, and now I am going to, as I move on, I'm moving on to your eyes. Okay, I'm going to check your optic nerve, which is your cranial nerve number 2. All right, look at this card for me and tell me what you see.
Heart.
Good. Okay. All right, and now I am going to assess your cardinal fields of gaze. This consists of your cranial nerve number 3, which is your oculomotor nerve, cranial nerve number 4, which is your trochlear nerve, cranial nerve number 6, which is your abducens nerve, okay? All right, and I just need you to follow my pen using your eyes without moving your head.
Awesome! Now drum along with the whole band.
Okay, now look at my pen, look at the wall, and then look back at my pen. All right, now I'm going to observe and inspect your external structures of your eyes, okay? By shining my light in your eye, I am looking at your conjunctiva. Your conjunctiva is pink and moist, and your sclera, which is the white part of your eyeball, nice and white. Now I'm going to get you to look forward. I'm in your peripheral eye, looking at your cornea, okay? I'm going to check the other. Nice and round, no drainage or signs of irritation. Looking at your iris, look straight at me. Light brown is your color. Okay. Now I am going to assess your pupil reaction to light. Just face me. You can stare at my badge, and I need you to just not move your head or your eyes, and I'm going to shine my light one more time in your eye. I'm just checking your pupil size. Good. Okay, now I'm going to assess your ears. I'm going to begin by palpating your ears. I'm grabbing, pulling, and pressing on your ear. Do you feel any tenderness?
No.
Okay, I'm going to observe I'm going to assess your cranial nerve number 8, which is your acoustic nerve. I'm going to whisper something in your ear, and you're going to cover the opposite ear while I whisper, and you're going to say the word out loud, okay? Cover your right ear for me. Good.
Baseball.
Okay, cover your left ear.
Football.
Good. Okay. All right, now I'm assessing your nose. Looking at your nose is symmetrical. All right. First thing I'm going to do is assess your olfactory nerve, which is your cranial nerve number 1. I'm going to pass something in front of your eyes. Close your eyes for me and tell me what you smell.
Alcohol.
All right, good. Okay, now I'm going to assess for patency. I'm going to get you to hold your left nostril and begin to sniff in and out through your right nostril 1 time. Good. And now we're going to do your right nostril, sniff out of your left nostril. Good. Okay, now we're going to go ahead and assess your mucosa. Lift your head back for me. Good. All right, your mucosa is nice and pink. Your nose, your septum is symmetrical. There's no signs of deviations. You can lift your head back down. Thank you. Okay. Now I am going to assess your mouth and your lips. Looking at your lips first, I see no cracks, no dryness. Nice and moist, no lumps, bumps, bruises, or blisters. Okay, you can go ahead and open your mouth. Say ah, stick out your tongue and say ah. Okay, I'm assessing your glossopharyngeal, which is your cranial nerve number 9, and your cranial nerve number 11, which is your vagus nerve. Your uvula is nice, round, and pink. Your tonsils are nice and pink. Your hard and soft palate is nice and pink. Okay, you can close your mouth. And now I'm going to assess your cranial nerve number 12, which is your hypoglossal nerve. I'm going to get you to say 3 words for me, and I am going to get you to say tat, rat,
and dynamite.
Okay, this concludes our head, eyes, ears, nose, throat, mouth, lip, and neck assessment on today. Thank you, Ms. Como, for being compliant with me, and nice meeting you.
Thank you, Jasmine.
Today I performed a head and face, neck, eyes, ears, nose, throat, mouth, and lip assessment on Mrs. Como. When I walked inside the room, I washed my hands to break the chain of infection. And then I explained my assessment, what I was going to be doing during the assessment to Mrs. Como. She was compliant before I began. So I went on ahead and began my assessment. The first part of my assessment, I just laid eyes on her and I noticed that her head shape was accommodative to her body size. Then I began palpating her skull and cranium. I was checking for lumps, bumps, or bruises, none noted. I inspected her scalp. Her scalp was nice and clean, no dandruff, no lesions, no lacerations. She said she didn't have any tenderness as I palpated her skull. I also palpated her temporal artery next, and she had no tenderness in that area. Then I did her sinuses, maxillary and frontal sinuses. She had no tenderness reported. Then I went on ahead and assessed her cranial nerve number 7, which is her facial nerve, and she smiled. She smiled, was able to frown, or puff up her cheeks. So I went and moved on to cranial nerve number 5, which is the trigeminal nerve. I assessed her trigeminal nerve. She was able to open her mouth, close her mouth, and bite down properly with no problems noted. Then I went on ahead and moved on to her neck. I looked at her neck. I noticed her neck was very symmetrical. I didn't see any lumps or bumps, so I began palpating her windpipe. She didn't have any pulsations, no lumps or bumps, no tenderness noted. So I went on ahead and began to name all 10 of her lymph nodes, and I asked her if she had any tenderness during those palpations. She said no, none in the pre-auricular, post-auricular, occipital, jugular, digastric, superficial cervical, deep cervical, post-cervical chain, supraclavicular, submental, and submandibular. No tenderness noted in those areas. Also, after I done her neck, I went on and moved it to her eyes. I assessed her optic nerve, cranial nerve 2. I asked her to look at the card. There was the word heart written on it, and she recited it properly. Then I asked her to follow my pen as I assessed her cardinal fields of gaze, cranial nerves 3, 4, and 6. No signs of confusion. She was able to keep her head straight and follow the pen properly. Then I began to assess her external structures of her eyes. Her iris was her natural brown color. Her conjunctiva was nice and pink. Sclera was nice and white. Cornea was nice and round. No signs of drainage or irritation. Then on the next part of the assessment, I moved on and began to assess her ears. I began by using my hands, palpating, pulling, grabbing as gently and pressing down to see if she had any tenderness, and there was no tenderness noted. Then I began to test her acoustic nerve, cranial nerve number 8. I just made her cover her right ear, and I whispered the word baseball in her ear. Then I whispered the word football in the opposite ear, and she was able to recite them out loud properly and follow through with directions. The next thing I did was I assessed her nose. Her nose was very symmetrical. Her nostrils were patent. I got her to cover each nostril one at a time, and she sniffed in and out properly, with no problem. Then I observed her mucosa by shining my light in her nostrils. It was nice and pink and moist. Then I went on ahead and shined my light again to look at her septum. Her septum was nice and symmetrical, no signs of deviations. Okay, and next I moved on to her mouth. I asked her to open up her mouth as I assessed her cranial nerve 9 and 10, the glossopharyngeal and the vagus nerve. Her uvula was nice, round, and pink. No swelling, no redness, no inflammation. Her tonsils were the normal, nice and pinks. No swelling, inflammation there either. Her hard and soft palate of the roof of her mouth was very nice and pink and moist. She was well hydrated. I got her to say eyes. I assessed those cranial nerves as well. Then I told her she could close her mouth, and she complied. She complied with no problem. And I did her last cranial nerve, which is her cranial nerve number 12, hypoglossal. And as I assessed her, I asked her to say rat, tat, and dynamite. She was able to comply with each word, and that concluded our head and face, neck, eyes, ears, nose, throat, mouth, and lip assessment on Ms. Como.